And we're back with the People Chronicles and Dr. Timothy Ring. We're learning a whole lot about some great life experiences. And the very last one was when you were in the Philippines, and then we rewound to where you got your start to going out and helping all kinds of people all over the world. And you started with New York. And since then, you have certainly filled the gap in between with so many different others and so many stories. What has been the most difficult? There has to be one that, whether or not it was when you had to use translators or a specific time when something was a little more difficult to get across to the people that you were trying to help. Can you think of a time where it was worse off more than another?
Well, actually, every one of these experiences is different and has its level of difficulty with regard to their uniqueness. The last experience going to the Philippines was, again, difficult in a very unique way. I inquired about going to the Philippines after the typhoon in November, Typhoon Haiyan, the locals referred to as Yolanda. And I inquired about it, and the organization I went through, International Medical Relief, put together a team that was deployed in late January. And I had the privilege, again, of being part of that team, physicians, nurse practitioners, and I was the only psychologist. Having gone with them before, they're quite familiar with me, and so I had kind of a leadership position there with the team. But at any rate, we flew to the Philippines, which started in Philadelphia to Los Angeles, from Los Angeles to Seoul, Korea, from Seoul, Korea to Cebu City. And as we were approaching Cebu City, we came in on a level 2 typhoon, Typhoon Bashan. And we circled Cebu City for an hour. The plane attempted to land in Manila, which took another hour. We came back for a half an hour and circled Cebu City a bit longer until the pilot finally landed, the only plane and the last plane to land. The city was pretty affected by this level 2 typhoon. The airport was a bit compromised. There were some broken windows. There was some puddles in the terminal. And as we were going through immigration, I had a backpack over my shoulder. I had some medical supplies on my other shoulder, and I was walking down a flight of stairs. And lo and behold, I missed the stair and slipped and fell and dislocated my kneecap. And, it's an eye-opening experience with regard to the pain and looking at your knee and seeing an indentation where there's supposed to be a kneecap. I guess the wave that came over me that was most significant was this old idea that I just traveled 30 hours and I might have to turn around and go home. At any rate, I was laying on the floor. I'm surrounded by physicians who are my team, and they put me in a wheelchair, took me through immigration to a hospital, which the hospital was 10 minutes away. It took an hour to get there because of the flooding. Mm-hmm. I spent the night in the hospital. We had x-rays. It was evident that my kneecap was displaced. I did the best I could to push it back into place. And then I had an immobilizer, and I made the decision to stay.
How long were you there?
2 weeks. So the immobilizer went after 2 days because I couldn't be mobile enough because we had to take a 2.5-hour boat ride to Leyte Island, and that was followed by a 2-hour cargo truck ride, and we didn't have any pain medication. I took ibuprofen. We didn't have any ice because there was not much electricity. But what I did have was this invaluable human virtue that we all have called vulnerability. And I learned a lot about myself having to be so vulnerable. I had to depend on others to help me get by. My own vulnerabilities, I think, helped me in treating people who were virtually without a roof, a house, clothes, food. And here I am, okay, I'm limping around a little bit. And by the way, some Americans go overseas and don't come back with their legs at all.
Right.
At least I came back with my legs, and, I've since had x-rays and an MRI, and I'm told in 3 months my leg's pretty much going to be fine. But again, at least it's still there. So I'm grateful for that. That was very difficult. I was in a lot of pain every night. But, I had to concentrate and distract myself from the pain. It was psychologically challenging. It was physically challenging. But to be that vulnerable under those circumstances, and ordinarily, I prepare myself physically before I go. I'm in the gym twice a day for weeks before I go. I eat differently. I'm conscious of my sleep.
So it's mental and physical preparation before you go away on these trips all the time.
Absolutely. You're walking in these disaster areas among rubble and, in the Philippines, there were places we couldn't travel by truck, so we had to walk in the jungle for a couple of miles. And I'm with my ace bandage and I'm trying to foot my load and stuff, but I was lagging behind 100 yards or so, and but I managed to eventually keep up.
So when you come home, do you ever say to yourself, that's it, I'm not going to do another one? Or are you constantly thinking about what it is or where you're going to go next?
Well, I do. Or where there's always a disaster. And as the director of disaster services in the country of Philippines, Dr. Butch Eng, who became friends, we became very good friends when we were there, he said, Tim, you can come back here anytime. We have 20 typhoons a year. We have 6 or 7 earthquakes, and we have 3 or 4 volcanic eruptions. So anytime you want to come back, there's going to be a disaster for you here. So I said, in fact, he for all intents and purposes offered me a job there. You could work here full time.
But you have a full-time job here in Berks County.
I do. I run a large psychological practice. We have thousands of patients in our practice. With my partner, we have over 50 clinicians that work for us.
Now, do you ever say to yourself when you're with the people here at your practice or the people that you deal with here every day on a daily basis, and you think of the things and the people that have come across your life and across your path, that life just really isn't so bad when you see what goes on around the world? How do you deal with what goes on here and what goes on elsewhere?
Jackie, empathy's not a quantitative thing, so everybody's pain is relative to their circumstances. So I'm in as much awe of people that I treat here that get through a horrible divorce as I am of someone who has survived a terrible typhoon. It's just it is this common thread that was woven through the fabric of human nature, which is this resilience and the strength of the human spirit. I see it every day. It's the joy of what it is that I do for a living, and I see it in every culture that I've been to on other sides of the world. It's the same. I've seen it in an earthquake in Haiti. I've seen it in the bayous of Louisiana. I've seen it on the shores of Thailand, and I've seen it in the jungles of the Philippines.
So where do you think the strength and motivation comes from inside of you? Where does that buildup come from to continue to do these things and volunteer your time and your heart and your soul and your mind, of all things?
It's like, I liken my skills to somebody that is an expert detonator of bombs. You know, it's like they have a tremendous skill, unfortunately, to be able to take away the explosive nature of a bomb because of their delicate handwork and expertise. I for some reason have this ability to be able to relate to people quickly, and in an empathetic, caring way, in a genuinely caring way. Some people I connect with in these places around the world in 5 or 10 minutes, and they're gone. But I give them some drop of hope. I have them tune into their own resilience and their strength by pointing that out to them, that they actually survived this disaster, they wouldn't be talking to me. And the other thing I convey to them is it is only by virtue of some quirk of a gene or chance that they're not sitting in my seat and I'm sitting in their seat. I could be them, and I'm not. I get to go home. So I give them as much as I can, and what they don't realize is they give me 100 times more than I give them, you know.
You talked about your team. Do they call you when there's different things going on across the world and say, okay, you know, you have a choice to go here or go there? And is it a local team, or where does this come from when the phone rings and they say, Dr. Ring, are you available? Or how does that work?
Yes. When there's a disaster, there's kind of a buzz among emails. And
they're all volunteers.
They're all volunteers, yeah. And, you know, in this particular trip, I work with an ER doc from El Paso, Texas. I worked with a nurse practitioner from Iowa, another nurse practitioner from California. So we convene from all parts of the country. And in this situation, we all convened in Los Angeles, and we flew to Korea from there. I've never met these people. Mm-hmm. So, you know, we all met in Los Angeles, and, you know, by the second day, you'd think we were family.
And do they have a name? Is there a name for this certain group of volunteers?
Yeah, International Medical Relief out of Denver, Colorado.
All right, Dr.
Great
Ring.
organization.
We could talk all day long. I could listen all day long to your stories. But the one final question that I do have is, what's next for you?
I don't know. You know, if you were to talk to some of my family members, they would say, could you please stay home for a while? Especially after this knee injury and stuff, because I've been pretty cranky with my knee. But you know, once that heals and stuff, yeah, you know, unfortunately, there's always something that happens around the world.
Well, we wish
I'll be
you
there.
well. Yeah. And thank you so very much for your time today.
Thank you, Jackie. Thank
Dr.
you.
Ring, I'm Jackie Hoffman, and this is the People Chronicles.